What's up, everybody? This is Christian Brindle. Welcome to another episode of the Everything Medicare Podcast, where every single week I bring you multiple podcasts where we discuss your Medicare, your Medicaid, your Social Security, and everything that has to do with that golden age called retirement. And today, folks, I wanted to start the episode off with saying, I've said it before, but I'll say it again. Thank you. Really, thank you. When I started this podcast, I had one goal in mind, and that goal was to make Medicare easy for the masses, as much of the masses as I possibly could reach. And we are about to crack. Actually, we have just actually cracked. I was mistaken. 12,000 downloads, and we're just probably at this rate we're probably pushing over about 1,000 downloads a week, roughly, give or take, depending on the week. And so we're just reaching more and more people. As I've talked about in the last few podcast episodes, we're now on Stitcher, and I have an offer to anybody from basically, when did this start? Let me remind myself. This started the 2nd on Monday. Okay, the 2nd of September on Monday. Basically from that day until September 16th. If we get 10 5-star reviews on the platform called Stitcher, I will disclose how much an insurance broker makes on every particular type of plan out there in commission. Now, this isn't to discourage you from working with a certain insurance broker, or anybody, or a broker in general in that matter, because truth be told, it's the same price as far as what you pay. It's the same price to get your program directly through the insurance company as it is through an insurance broker. There's no downside for you, but it's not a bad idea to be aware of it, because a lot of agents strictly recommend products based on what's going to impact them the best. And I think it probably could be a good idea for you to be aware of that. But I'm only willing to do it if you help us move up the ranks in Stitcher. 10 5-star reviews, that's my deal. You have the rest of that time period, so September 2nd, which was Monday, till September 16th, which is 2 weeks from Monday. That 2-week window, 10 5-star reviews, and I will do that podcast. If we don't get it, if we get 9, I'm not doing it. So, just wanted to remind you of that, okay? But thank you so much for being so wonderful and for being such a great audience. I am blessed to be able to talk to people as great as you folks are. Okay. Also, in case you didn't hear the last episode, this podcast is now on video. Okay. I am being recorded. As uncomfortable as I am with doing that, I'm being recorded while I do the podcast. And it's going to be put on YouTube each and every episode. I think the first episode we did was Mondays, so a few days ago. But going forward, we're going to be putting every single episode we do on video on YouTube. So if you'd like to see my ugly mug while I do this, you can find me on YouTube. Okay, Christian Brindle, the Everything Medicare Podcast. Now, the past episodes will all be up on YouTube. They already are up on YouTube, but just the audio. It's just the episodes going forward. I can't go back in time and record myself doing the past episodes. So, just some news, just some updates, okay? So let's get into it. So today, we're talking about a product known as a hospital indemnity product, okay? Many of you might be familiar with this type of product. Many of you might not be. It's kind of one of those things where it's either you know everything about it or you know nothing about it. A hospital indemnity product, folks, I've talked about them before, is a type of ancillary product. An ancillary product. Now, what's an ancillary product? I've talked about this when we've done our episodes about dental, vision, hearing programs. I've talked about this in the past when we've done our cancer policy programs. An ancillary product is something that partners with a Medicare plan. So if you pick up a Medicare supplement with a drug plan, or if you go pick up a Medicare Advantage plan, an ancillary product is something that goes with those things, that covers things they don't cover, or patches in a hole that they leave behind. Okay? So ancillary products are something that some people need, but not everybody needs. So I want to preface my comments about the hospital indemnity product or any other ancillary product and just help you understand, they're good for a lot of people. They help a lot of people. But they're by no means a necessity for everybody. Okay, so please keep this in mind. It really just depends on your specific needs and preferences, and I'm going to be a broken record about that because people need to understand that. It's vital that you just don't pick something up because Christian said you should. Okay? I think some people could benefit tremendously from a hospital indemnity plan, but I think some people it's just a waste. They don't need it. So let's get right into it. So what is a hospital indemnity plan? Okay, so hospital indemnity plans, for the most part, are really designed to partner and go with a Medicare Advantage plan. Okay? They really don't make any sense if you have a Medicare supplement. Because Medicare supplement gives you full coverage, if not close to it. A hospital indemnity is designed to come in and pay some high medical expenses that are left behind by a Medicare Advantage plan. It makes absolutely no sense to pick one up with a Medicare supplement. So if you have a Medicare supplement, forget about it. It doesn't make any sense. I've seen a lot of people over the years come to me that have a great Medicare supplement, and some sleazy salesperson came in and sold them a hospital indemnity program on top of it, and an expensive one at that, and they don't even know what it's for, and they've been paying for it for 2 or 3 years. Don't be that person. Okay? Be educated. Be educated on what your choices are, like what you're doing right now. I commend you. Hospital indemnity plans, folks, are designed to pay some of the larger copays left behind by a Medicare Advantage plan. Medicare Advantage plan copays obviously vary based on the insurance company, the specific plan, and also the market that you may be living in. So some people might be able to use these programs more than others. But in my opinion, I've always looked at a hospital indemnity plan as the perfect program to partner with a $0 premium plan, because you're not paying any premium for the Medicare Advantage plan. Hospital indemnity can come in and pay some of the larger copays. So I'll explain what I mean. A hospital indemnity plan basically will pay. It depends. I mean, obviously, the more you have it, the more things you have it packaged in, the more the premium is going to be. But you're typically looking at about $20, $30, maybe $40 a month in premium for a hospital indemnity plan. A lot of the good carriers will give it to you for free. Excuse me. I'm not in my brain today. Not free. Forget I said that. A lot of the carriers will give it to you with no health questions. I meant to say when you turn 65, but not all do. Keep that in mind. But no health questions when you turn 65. Okay, now if you try to get one down the road, let's say you're 68, 69, 70, and you want to pick one of these up to go with your Advantage plan, you might have to pass health questions. It's very realistic. But they're probably going to cost $20, $30 to $40 a month, roughly. I think if you're paying any more than that, it's a freaking ripoff. And I've seen people pay $80, $90, $100 a month for a hospital indemnity plan. Don't be that person. Don't do that. It's not worth the money. It's not worth that amount of money. It's just not, okay? But a hospital indemnity plan, typically, when I recommended them for folks, they're typically, the main purpose of them is to pay the inpatient hospital copay of a Medicare Advantage plan. Let me explain. A Medicare Advantage plan typically depends on your market. Now, if you live in a place like Miami, you probably don't have this, okay? So I'm not talking to every market, but most markets have an inpatient hospital stay. It's very common for a Medicare Advantage plan to charge you a copay per day in the hospital for days 1 through 5 or 1 through 6 or 1 through 7. It just depends on your plan. And it could be $100 a day, it could be $200 a day, it could be $300 a day, it could be $400 a day. It depends on the plan, it depends on your market, it depends on a lot of things. But you're probably looking at somewhere between $100 a day to $400 a day. Now, that's going to cover your whole visit. Okay? All the doctors you see, all the doctors you don't see, the hospital room, the bed, the anesthesiologist, the IV in your arm, the MRI machine, it actually does a very good job. It could be costing them $25 to $30 a day to keep you in the hospital, and the plan pays everything with the exception of whatever that copay is. So it's pretty good coverage, all things considered, by itself. What a hospital indemnity does is a hospital indemnity comes in and picks up a portion of that copay or all of it. It just depends. It depends. You kind of specifically design your hospital indemnity plan. So it could pay $100 a day And typically they'll do it. There's different types. Some hospital indemnity programs will be basically a lump sum. Okay, so they might be $1,000 lump sum if you spend one day. Okay, it might be $200 a day for 10 days. Okay, but the way they operate is typically they'll reimburse you. So you pay your copay out of your pocket, they reimburse you. Okay, the nice thing about it being a reimbursement service is you don't have to worry about networks. The bad thing about it being a reimbursement service is you have to pay first and they pay you back, and if you don't do it exactly right, it can be like jumping through hoops. So that's what you're looking at, okay, with a hospital indemnity plan. But typically hospital indemnity plans cover other things too, and a lot of them will give you the option of adding different perks on. So like another really popular one is a skilled nursing facility. Okay. Medicare Advantage plans a lot of times for days 1 through 20 in a skilled nursing facility. And for those of you who aren't familiar, a skilled nursing facility is like spending the night at a rehabilitation center. You know, a place where you need to spend weeks at a time, month at a time, something like that. Usually the first 20 days are free. With most Medicare Advantage plans, they pay it all. But then usually from day 21 through 100, you have some kind of copays involved. Some plans do better than others on that. Hospital indemnity plan typically has a benefit where skilled nursing can be added on, and they'll reimburse you for most of that cost if you're there longer than 20 days. If not all of it, it depends on your benefit. A lot of them will have an ambulance rider. They'll help pay your ambulance copay. There's a lot of things. Some hospital indemnity products can even have a dental, vision, hearing rider. So they're good, they're fine, but it depends on your situation, and I will disclose who should get a hospital indemnity product in segment 2. Don't go anywhere. Stay right there. Welcome back, everybody. This is segment 2 of the Everything Medicare Podcast. I'm your host, Christian Brindle, just outside of Salt Lake City, Utah, in our offices here at Christian Brindle Insurance Services / Brindle Insurance Group, which is our parent company. Hospital indemnities, folks. Hospital indemnities. Okay. You might be sick of it. You might be tired of hearing me explain things this way, but not must be too tired because you keep listening. Okay, so I like painting a picture in this regard. Okay, I like painting a picture this way. So I'm going to tell you a little story to get the point across on who should pick up a hospital indemnity plan and who shouldn't. But in this scenario, I'm going to give you 2 stories. I'm going to give you person A and person B. Person A should pick up a hospital indemnity plan. Person B should not. Okay, so pay attention. So we're going to talk about person A first. Okay, person A is someone that has a fixed income, like a lot of you, like a lot of people on Medicare. Person A really would like a Medicare supplement plan, but person A just really is not sure how she can budget for the premiums. Understandable. A lot of people are in that boat. So person A takes a $0 premium Medicare Advantage plan because there's a good one available in her market, but she's afraid of the copay. She wishes she could have better coverage. Person A finds out about a hospital indemnity program. She can pay $25 a month, and she can have a couple of her large copays covered. Because a hospital indemnity plan, folks, it's almost like a supplement to a Medicare Advantage plan. Although it's not typically all the way like a supplement, because with a supplement, a traditional Medicare supplement, you really don't have any out-of-pocket, but work with me on this. It's a supplement in a way because it supplements parts of the Advantage plan. A couple of different copays, usually 3 to 5. So person A picks this up, pays $25 a month. She's got some health problems. She goes to the hospital from time to time. She uses her plan a little bit. Hospital indemnity plan She pays $25 a month. So that's basically about $300 a year. She spends some time in the hospital on 2 separate occasions throughout the year, has an ambulance visit, things like that. The hospital indemnity plan pays out over $1,000 in reimbursement claims to her to help pay her large copays on her Medicare Advantage plan. That's worth it for person A. That is the next best thing to a Medicare Advantage plan, a Medicare Supplement plan. A Medicare Advantage plan, a low premium particularly, with a cheap hospital indemnity. So person A did it right. Now let's talk about person B. Person B has a Medicare Advantage plan as well. But person B is healthy as a horse. Person B never goes to the doctor. Person B doesn't take any medications. Person B doesn't spend any time in the hospital. Person B also has a good amount of savings. This matters. I'll explain why. Person B is just wasting her money to pick up a hospital indemnity plan. I'll tell you why. Person B is healthy as a horse. There's a lot of people that pick up hospital indemnity plans that primarily don't need them. They don't use them. Okay? They're just not of any use to them. So if you're on a hospital indemnity plan and you're paying $300+ a year in premium and you don't use it over a 3-year span, guess what? You spent almost $1,000 out of pocket in premiums. That's what we don't want. I've done plenty of episodes in the past that talk about how you can avoid being insurance poor and how you can avoid paying for things you don't need. For person B, it's something she doesn't need. Not to mention, let's talk about the other side of the equation. Person B has a lot of savings. She's well off. She can pay the copays if she needs to. Whereas paying the premiums, assuming she might need the copays, but she's paying premium for something that she doesn't really need. So those are 2 scenarios, 2 basic everyday scenarios that I run into constantly about hospital indemnity plans and who should get them and who shouldn't. Okay? So you know your situation better than anybody. You know it better than I ever could. You know it better than your insurance agent ever could, if you have one. You know it better than any salesperson that's going to walk through your door. Don't let anyone talk you into something that you don't need. But don't be so closed off that you miss out on an opportunity to be covered for something that could help you out. It just depends on your situation. And the point of this episode and the point of this podcast is to explain the good, bad, ugly, everything you need to know about it, so that way you are more qualified and in a better position to make the best decision for you. Stay with me into segment 3. Don't go anywhere. Welcome back, folks. Welcome back. Thanks so much for sticking with us all the way to the end. Not too much to say about this topic. It's pretty easy. I mean, it's pretty straightforward. It's all about your needs, like everything. But there's not a whole lot of working parts to a hospital indemnity plan. Folks, with us approaching the enrollment period, I'm going to be doing more and more centric episodes that specifically talk about what you need to do during the annual election period, which stands for AEP for short. That's basically the time period where everybody on Medicare can change their program. Basically, if you have a Medicare Advantage plan, you can change to original Medicare with a supplement and a drug plan, or you can go to another Medicare Advantage plan. If you have a supplement and a drug plan and you want to go to an Advantage plan, you can do that. If you want to go from one Part D drug plan to another Part D drug plan, it's pretty much a free-for-all in which you can do these things. I'm going to be doing a lot of episodes and a lot of content about what you need to do during the enrollment period. But folks, if you'd like to work with me personally, if you've listened to me for some time and you'd like to work with me on your Medicare, I work with people in the states of Utah, Florida, Idaho, and Oregon. Okay? I work with, my organization partners with some of the largest insurance companies in the world on Medicare. Our job is to sort through the options and help you find the best available fit specifically based on your needs and preferences. You might be on Medicare and you're just not sure if you're on the best thing for you. Maybe you're turning 65 and you're just bombarded by all the options and you just don't know which way to go. We can help you. Give our office a call at 801-255-5340, 801-255-5340, Christian Brindle Insurance Services, and we'd be happy to talk with you. It doesn't cost a penny to work with us. There's no obligation at all, and we give you year-round customer service on your Medicare plan, on any plan that anybody has through us. Okay. As always, folks, don't forget about my offer with Stitcher. Help us climb the ranks on there because we're brand new on that platform. We're not as high in the rankings as we are on any other platform we're on. Like, for example, on Apple Podcasts, we're the second-rated Medicare-centric podcast on Apple Podcasts. We're trying to get to number 1 on that spot. But at the moment, my concentration is focused on Stitcher. Pretty soon, we're in the works on getting the podcast on iHeartRadio and Pandora, so stay tuned for news about that. And, folks, thanks for listening. Thanks for tuning in. Contact us on social media. Christian Brindle for my fan pages on Facebook, Instagram, or Christian Brindle Insurance Services for our organization. On YouTube, Christian Brindle, there's a little cartoon emoji face. That's supposed to be me when I started. I've aged a little bit since then. But let us know what topics you'd like us to talk about going forward. And if you're watching this on YouTube, drop a comment in the comment sections on what you'd like to hear in future videos, in future episodes, in future topics. And what are you confused about? Let's talk about it. Let's make an episode all about it for you. Thanks for listening. I'll talk with you soon. Have a great day, everybody.